For years now, medical doctors trained in Nigeria or Nigerian institutions have been steadily migrating to other countries due to issues ranging from poor working condition, inadequate remuneration, obsolete medical equipment, political instability, shortage of economic opportunities, and others. This brain drain is worsening the depleted healthcare resources in Nigeria and widening the gap in access to quality healthcare. In a bid to reduce this, during his 2022 budget defense last year, the Minister of Labour and Employment, Dr. Ngige, advocated for a compulsory 9-year service for all Nigeria-trained doctors before they would be allowed to emigrate. With a steady rise in medical brain drain in Nigeria, the big question is, how can we solve this problem? So we're speaking with a certified pharmacist and public health physician, public health specialist precisely, Nsiabasi Ekanem. He's in the studio with me, and the Executive Director, Health Emergency Initiative, Pascal Achunine. Thank you very much for joining me, gentlemen.
Thank you for having me.
It's good to see you.
Thank you.
Right. Let me start with you, Dr. Nsiabasi. Sometime in August last year, the government of Saudi Arabia sent in some agents to Abuja to recruit Nigerian doctors. And that generated a lot of reactions, even from the federal government itself. So talk to us about the level of brain drain in the medical profession.
Well, it's quite disheartening right now that we are having lots of doctors trained in Nigeria, not just doctors, but healthcare practitioners in Nigeria moving to North America and European countries in search for greener pastures. And I mean, in fairness to them, you would perhaps not really find fault in what they're doing when they have better standard of living out there. Their services are in demand in those countries. And besides the money or besides the remuneration package they get, they have more fulfillment in those countries. I mean, you now realize that there are push and pull factors. Push factors are those factors that are pushing them out of Nigeria. Like we've seen the last year, we had several months of industrial action by resident doctors in Nigeria. And of course, we knew what their grievances were. Now, when sometimes we do not, take cognizance of these grievances and address them promptly, I mean, doctors will not have any other option but to leave and go to places where they feel they are better appreciated. Second, sometimes you see these doctors, for example, a specialist, a neurosurgeon, or let's say basically surgeons. Most surgeons, they don't get to even practice what they have learned in the country because we don't have the equipment to carry out such surgeries. Only until recently, most cancer surgeries were done outside the country. So what happens to a trained clinician in Nigeria who is trained to carry out such kind of surgeries? He or she does not see that avenue or have the opportunity to actually practice what he or she learned. I mean, there is not, that self-fulfillment is not there. And when that happens, I tell you, the only option they have is to go to places where they can actually practicalize what they learned. Because for them, it's about self-actualization.
Well, I read it a little earlier, but then I'll go to that. But let me come to you, Pascal, Dr. Pascal Achunine.
Pascal Achunine.
Yeah, absolutely. Okay. But the Minister of Labour and Employment, Dr. Ngige, said that we've got enough medical space in Nigeria. He said that sometime in 2021. He said they're free from Nigeria, and we've got. So why should we worry?
It's sad because such pronouncements were based on data. It will be very, very regrettable that we have that kind of communication coming from such a high office. The current requirements of doctors in Nigeria is 300,000.
Yeah.
Currently, NMA record shows about 75,000 Nigerians medical doctors have so far been trained, but about 33,000 or less are currently practicing in Nigeria. And when you say that 33, as I speak to you, annually 2,000 migrate out of Nigeria to all these countries he made reference to. So again, you look at the ratio, what is WHO ratio, a doctor to a patient? 1 to 600. In Nigeria is 1 to 4,000. So are those communications or pronouncements based on empirical data? Are we okay with the death rate in Nigeria if we have a situation where 627,000 people die of malaria annually and 27% are Nigerians, especially children? That alone should be a signal that we have an existential threat. If you check our records on child and maternal health, it is a disaster. You come to cardiovascular related cases, many are, let me give you an example. Just last month, we had a case where someone was taken to a private hospital. There's this soup kitchen organized by one of our partner NGOs, and someone went there to one of the 15-year-old boy, but he had stomach-related infection. The team took him to a private hospital, and when they got there, in less than 2 hours, we were preparing to wheel the boy into the theater. Wow. They called us because they needed help. Our organization supports indigent patients and accident victims. So they called us that they were in such a tight situation. Can we assist? I said, okay, let's talk further. They brought him to our office. I said, can we have a second opinion? Why not take him to Rando General Hospital? We have good relationship with them. And they got there through the goodwill. In less than 2 hours, they were able to do a scan and some tests, and they saw that it was an infection. This boy was to be wheeled to the theater for appendicitis surgery. So that boy would have been treated for the wrong thing. He would have probably had some terrible consequences arising from that. Why are we having that? So if you check this number, assuming we even the 33,000 we talked about, and I'm just not limiting this to the medical doctors. We are talking about nurses, we are talking about radiographers, we are talking about medical life scientists, the entire value chain. They are going out, streaming out in their large numbers. We don't have a system, even for the ones that are practicing, most of them do not have the refresher and, okay, let me put it in simple terms. Many of them are overstretched that they don't give out their best sometimes. Because, let me give another example. A young doctor I met recently said in one of the mainland hospitals that he resumes at 7, but by 4 to 5 a.m., the people, they give them tally. He has about 300 patients he will see between that 7, 8 a.m. till 5 p.m. So most times he's spent. So we have few who are tending to, I talked about the ratio. Anybody who loves this country cannot be indifferent while Rome is burning.
That's quite amazing. Dr. Nsebase Kanem, sometimes when you want to go see the doctor, you want to have a conversation with the doctor, you want to spend enough time, just like he said, you don't have that luxury of time to even get yourself examined to a very large extent. But then the government is responsible for the welfare and safety of the citizens they represent in governance. But if they are not taking care of the doctors, how then will the dividend of governance trickle down, to them? So how much would you say the government has done in this regard in acceding to the pleas of the medical practitioners?
All right, so I'll put it this way. You see, in 2014, the National Health Policy was enacted. And in Section 5, Paragraph 3, actually talked about human resource for health. And it talked about recruitment, remuneration, training, and all of that with regards to human resource for health. Unfortunately, and there was, in that policy too, there was supposed to be a yearly review of the entire package, the entire system. Unfortunately, I'll tell you that I'm not sure that there has been any review since 2014. I'm not sure there has been any review. And so at the end of the day, you see some doctors who earn the same thing they earned in 2014. They are still earning that despite the inflation rate. And you see, these are some of the factors that discourage them. It is the duty of government to make sure that funding for healthcare system is adequate. But of course, we know that Nigeria, well, I would say this way, in fairness to the government, Nigeria is not such a super rich country because when you look at the budget that America earmarks for only health, it's almost the entire budget that we earmark for everything in this country. So what do? I think what we should do is to bring in other sectors. We have the private sector. Look, Nigerian pharmaceutical company, our pharmaceutical industry is multi-billion dollar worth company. How do we harness that opportunity? We have the social sector. We have development partners. How do we bring everybody to the table and say, look, we need to solve the problems in Nigeria? I have no doubt that we have already identified the issues. There's no technocrat in this country that you call that will not list our reel of all the challenges that we have within the healthcare sector. One of them is funding, but it's not only funding. Another issue is efficiency in the use of resources. I'll give you an example. In Finland invests less amount of money per capita in healthcare compared to the United States. But if you look at the indicators, you see that Finland does far better. In fact, Finland is the best country in the world when it comes to healthcare. They have better health indices than any other country in the world because they efficiently utilize their resources. There's a lot of wastage in Nigeria, I will tell you. If we can harness the potential we have from different sectors, the public sector, the private sector, and the social sector, and then build in efficiency so that whatever resources that we put in, by the way, efficiency is about using the least resources to get the best output. Let us use the little resources we have and get the best that we can get from it. That is the work of the government. That is the duty of the government to build in that efficiency into the system by strengthening accountability, transparency, and effectiveness in the delivery of healthcare.
Well, judging from the treatment of nurses and midwives, doctors, medical practitioners altogether in the country and the welfare, do you think people are still attracted to this profession after all?
People are absolutely excited to be health practitioners, not just in Nigeria, because I've seen many who are bankers, rose executive level in banking. They relocated to the US, went for 3 years, short or executive courses, got their license, and so excited they are practicing as nurses. So, and when they compare what they earn and what they could have been doing here, earning in Naira, they are so excited to have that they relocated with their families. So it is still very, very attractive. And I want to put it in perspective.
No, attractive in all the times, yes, but I'm saying attractive to people who are willing to practice in their own country.
Oh, really? It is a thing of honor to be a health professional in the first place. And from the benefit of hindsight, we see that a nurse, a doctor, or any of those professionals practicing in the past, they were very excited. And we still cannot. Some people do not want to leave because they have emotional attachment to their fatherland. Everybody will not live here. Some are waiting. Okay, would there be someone who emerge tomorrow who would like to run the affairs of the state better? So just to put it in perspective, it is very exciting for many to practice here. And some are also making good money here, especially when they explore partnerships. I've seen some persons who have skills as pediatrics, some gynecologists, they come together, so they build synergy. But I just want to add a little to what he said. We must move from wishing it. He talked about collaboration between private sector and social sector. We have experienced amazing results working in the last 7 years as an organization. We've seen some private sector organizations who did CSRs. Okay, handle this for us. Let me tell you that one of the children's hospital late last year wrote to us that for the first time they saw reduction in death rate in their facility.
What was responsible for that?
Because they deploy resources to us and they saw that our process of assisting indigent patients was transparent and accountable. And they saw value. The hospital got the value. That organization saw value in a huge impact in what the resources they deployed, and they came back to renew their relationship with us. So I think we need to move from wishing it. We need to roll our sleeves. We need to provide incentives to private sector operators, private medical facilities, because 70% of Nigerians still use private hospitals. Public hospitals don't have enough resources to also accommodate people, because, let me give you an example. We see some paramedics or ambulance services, they pick accident victims from the road. They get to this hospital, big hospital, and they say no bed space. They go to another one, no bed space. And they are unable to go to private health facilities. In some other cases, even when there is bed space, no deposit, no treatment. That's why that area will be coming as next of kin health emergency initiative. But we must begin to work together. Government must know that it must lead from the front. The private sector must move a little beyond doing reality TV sponsorship to putting resources in the private sector.
Well, a lot of Nigerians generally may not understand that some of these issues are actually caused by the inadequacies the government, it's not providing for health professionals. That's why sometimes you see some people who lost their loved ones, they fight the doctors, they cause a lot of scenes in the hospital, and they also blame doctors for some things whenever they go awry. What would you say regarding this? Because you said pooling resources together. Is it possible that, fine, we know that the government may not be able to do as much as we want. Is it possible for us as health professionals to say, okay, with the little that we have, we'll magnify its utility?
Well, I think the best that we can do as healthcare professionals is to provide that level of care, because that's, in the first place, that's why we were called as professionals. But you see, while providing the level of care, I need to put things in perspective. You see, when you're working in a healthcare setting, all right, there are certain incentives, like you talked about, that helps you as a healthcare professional to work. There are things like job aids. It's not just about the money, I must say that. Sometimes there are things like training, in-service training. They are very important. Most times you see doctors would go for this training, they write their exams, they go for a fellowship at their own cost. They're the ones paying for this. Now, in some other climes, the government comes in and say, okay, look, if you have interest in going for these specialist courses, we would help you. We would, provide that financial support so that you can go in, get the knowledge, because at the end of the day, you are also going to invest this knowledge in taking care of the people who are citizens of the country. And unfortunately, we see most times there's this lacuna where the government is not able to collaborate like it is with the private sector and other sectors of the economy. Yeah. So if we are really serious about fixing the problem within the healthcare system, then we must bring everybody together, and we must be deliberate about every approach that we take. And in all our approaches, we must evaluate to be sure that they are result-oriented. That way, we can build a healthier system that will be not only resilient, but will be able to take care of the major problems within the Nigerian healthcare system.
Well, let's talk about the health hazard, of the profession. Like any other professions, the one who ensures safety of others too is also exposed to lots and lots of dangers. And how has the government honored the health hazard allowance for those who are involved in one accident or the other, in the course of the job?
Yeah, we recognize that there are resource constraints. No economy has all the resources it needs, but it is much worse here. But we cannot see adequate motivation for health workers if you commit only 6% of your annual budget, less than 6% to the health sector. We cannot see that happen in a situation where you allow strikes to last for 6 months, 3 months, 2 months, weeks in the health sector. We cannot talk about adequate motivation because there are 3 contexts here. Production, are we even producing enough health personnel to cover 200 plus Nigerians? Retention, are we putting in place measures that will make them stay? And motivation. So the motivation is the last lap we are talking about now. So when we have a situation where ASU is on strike for as much, and ASU is not teaching people who are unrelated to healthcare sector, the universities produce this doctors, health professionals. So if we show indifference to such critical issues, then it means that we are paying a lip service to it. So and again, let's even say you pay hazard allowance of 30,000 naira to a doctor. Place it side by side with somebody who is practicing in Saudi Arabia, who is practicing in the UK, in the US. What is it? It's what they will use to buy pizza to go. So it is the macroeconomic environment makes even the efforts put in place at the ministry or regulatory level, it makes it look like peanuts because the economy is in crisis. So if the economy is in crisis, these people don't live outside this economy. So there must be a broad-based approach to fixing this. And the best time to do it was yesterday. The next best time is now. And the reality is that we don't keep data here. The number of people who are dropping dead daily because of this failed system is horrible to think about. So the time is now for action for everybody. Corporate sector, step into, deploy more of your CSR to health. Government, move beyond rhetorics, go into real engagement, broad-based collaboration. And I want to make this postulation. We can put in place a medical intervention trust fund built around strong governance system that can at least take this layer, and we start building measurable mechanisms to track the progress.
He made an allusion to the fact that we are not really producing enough medical personnel in the country. Is that to say, or how would you reason with the Minister of Labour and Employment when he advocated for a compulsory 9-year service for all Nigerian trained doctors before they will be allowed to emigrate?
That's infringing on their fundamental human rights. You cannot force anybody to stay and work in a system.
No, because he believes that you going to school, studying medicine, the government also pays, subsidizes education for you.
No, fine. I understand the fact that most people.
So if you're trained on the nation's resources, you should be able to give it back to the nation, at least to a reasonable extent.
Just to put things clear, it's not all doctors trained in Nigeria that attended public schools. The only ones who probably had benefited from the government subsidy in terms of education are those who went to public schools. What about those who went to the private schools? You see, like I said, and I'll say again, funding is not only, remuneration is not just the reason why people leave. There are a lot of push factors that I talked about. If you are not having that self-actualization, if you are not having that job satisfaction in the country as a clinician or a healthcare professional, you leave. Like I mentioned, if you are you are a neurosurgeon, all right, your work is to carry out, spinal surgery or, surgery of the brain, all right? Let me put it that way. Now, if you are not able to do it, what are you doing? You only train, the only work that you do is to train resident doctors. Is that the only thing you can do? When you have an opportunity out there where you can actually practicalize this. And let me tell you something. As a clinician, as a healthcare worker, there is no satisfaction beyond you seeing people's life being saved because of what you're doing. That is the major satisfaction for a healthcare worker. And if you don't have the facility to do that, I tell you, there's no amount of money that you'll be paid that you still remain in that system. So if you want to trap down by telling people, okay, I want you to stay here, stay and do what? Most doctors, if you go to some facility, most doctors, they want to work, but they don't have what to work with. I can tell you categorically because I've supervised a number of projects. In 2020, I supervised a UK-funded project, and I visited a lot of hospitals in Nigeria. And I saw that a lot of doctors sometimes become redundant. Even the last thing as hand gloves they don't have. Do you know that some doctors have to pay for medical tests for patients? Honestly, let me not go that far, but I tell you that many doctors in this country are frustrated because of the entire system. So if you don't build a good system, a resilient system, if you don't strengthen the system, there's no way you can have them stay.
All right, we're costing home now, and I want you to react to this in less than a minute if you can. How imperative do you think then we need to include health professionals in decision making on various health policies that we do in this country?
If as long as we keep them off, we are sidestepping the real issues. And I want to announce to everyone, the survivors of yesterday are today's victim. The survivors of today are tomorrow's victim. So if you're in decision making and you're in a position to do something, it may haunt you if you fail to do something today. Let's fix the health system in Nigeria. It is in a crisis situation.
What goes around comes around, so they say. So your final thoughts on this,
well, what I would say is that the government should actually, like you said, lead from the front. You see, we are done with all these rhetorics. We should actually itemize the issues and look at the low-hanging fruits. Which of them can we achieve now, and which of them can we achieve in the long run? We should factor in the healthcare system and its benefits in everything that we do. If we need to increase taxation, fine. But whatever we can do so that we can earmark more funding to the healthcare system, I think is best. And then we should be able to build an enabling environment for healthcare workers to work and have that self-actualization in serving the life of people.
Well, thank you very kindly for your time. Certified pharmacist and public health specialist Ngige Ekanem, thank you so much for your insight. And also Executive Director Health Emergency Initiative, Pascal Chunine. Thank you so much for your keenness of insight. Really appreciate it.
Thank you for having me.